Good morning, everyone, and welcome to the HCP Care Coordination and SHCN Data System Training. My name is Rachel Hudson, and I am the Director of the Children and Youth Branch here at the Colorado Department of Public Health and Environment. And with me in the room and presenters for this training include Annie Whitehouse, who will be speaking in a little while about the care coordination model, Ashley Juhl, and Dale Nakamus, and they will all be introduced as they take on their part of the presentation. First, before starting the training, we want to go through the training materials packet that you should have downloaded before logging on and beginning the training. There are 15 documents included in that packet listed on this slide. So it starts with the HCP Care Coordination Action Plan, the HCP Care Coordination Assessment, the HCP SHCN Data System User Manual, the SHCN User Account Request, the Framework for Intake Interview Questions, the HCP Care Coordination Flowchart, the HCP Care Coordination Introduction, the Training Agenda, Intake Interview Questions, and then 3 separate documents that include Intake Scenario 1, Intake Scenario 2, and Intake Scenario 3, a Next Steps handout, the State HCP Care Coordination Logic Model, and then the HCP Training PowerPoint slides. And these are all available on the HCP website. Before we get started in the training, if you have questions throughout the training, please write down your questions as you go through, and your Next Steps handout includes a list of state contacts who can answer your different questions. In addition, on the HCP website, there is a frequently asked questions document that was compiled based on the questions that emerged in the trainings that were completed in September and October of 2011, and again is posted on the HCP website. And as a reminder, if you need a break during this recorded webinar, please press the pause button to pause the training video, and then you may resume when you return back to your desk. So the training objectives of the training, for all local HCP staff, the goals are, or the objectives are, to recognize why HCP Care Coordination, why the process and data system have been revised, to be prepared to implement the 5 components of the care coordination process, to identify data collected in the SHCN data system and information that HCP will gain from the data, to be prepared to enter HCP Care Coordination data in the SHCN data system, to know how to access continued learning opportunities for care coordination and data entry after the training. And as I mentioned, my name is Rachel Hudson, and I direct the Children and Youth Branch. And just to give you a little bit of background and context about myself, I am a pediatric nurse practitioner by training, and I've been here at the Health Department for a little over 10 years. I came to the Health Department from the Colorado Coalition for the Homeless. I worked in clinical practice at Stout Street Clinic, which is part of the Coalition for the Homeless, and saw children, youth, and families at Stout Street Clinic. And then came to the Health Department about 10 years ago as the Director of Early Childhood Initiatives, and was in that role for several years before becoming the Director of the Child, Adolescent, and School Health Unit, the CASH unit, which as of last April integrated with the unit that was formerly known as the CYSHCN unit, the Children with Special Health Care Needs unit. So with the integration of those 2 units, we came together to leverage our resources across the 2 units for the benefit of all children, including those children and youth with special health care needs. And in preparing for this training, we thought it would be helpful to paint some context for the new care coordination model and the new SHCN data system in terms of where we've been, where we are now, and where we're going. So where have we been? Over the course of the last several years, well, and I should back up and say as of 2003, HCP has been through, or since 2003, HCP has been through a pretty significant transition away from paid services into what is now a focus on HCP Care Coordination and HCP local systems. And since 2003, those who have been with the HCP program since that time have have really seen the evolution in the focus and the changes in the program over time. The feedback that has been received from many local folks from around the state have provided feedback to Karen Trueweller, to Kathy Waters before she retired, Shirley Babler, now since April, to myself, about concerns about the HCP program around expectations and setting clear expectations. And so the result of those inconsistent expectations has been a lack of clarity in terms of implementation around HCP care coordination, meaning that care coordination did not necessarily look the same from community to community. And this has led to an inability to gather an aggregate picture of statewide care coordination efforts and an inability to create meaningful data reports that inform state and local HCP program planning. And so the rationale for this slide and the reason this slide is in here is not to diminish the care coordination efforts and the great services that have been provided statewide. It's really to demonstrate that state HCP staff have really looked at or listened to the feedback that we've received and taken a hard look in the mirror in terms of how we can do a better job of providing consistent expectations across the state so that we can paint that aggregate picture of the folks that are receiving our care coordination services and ultimately the outcomes of those services and the benefits of those services. So where are we now? We, of course, do not want to throw the baby out with the bathwater, and the care coordination model that you're going to see presented throughout this training is built upon the great work that happened in the past. And so Barb DeLoyne did a lot of work and solicited a lot of input from local HCP offices around the care coordination model, and that framework you'll see still exists, and the refinements are also exist. So throughout the training today, you will see things that remain the same and may be familiar to you, and you'll also see things that may look different. So the overall goal of HCP has not changed, and it is to help improve the health, development, and well-being of Colorado's children and youth with special health care needs. And to accomplish this goal, the aim of HCP Care Coordination is to assess the needs of the child or youth and their family, empower and support the family in meeting these needs, and to improve the coordination of needed care. So these components or these core tenets still remain the same and should be familiar if you have been in the HCP program prior to this new model in this training. In terms of something that may look new, there are 5 identified core components of the HCP Care Coordination model, and this is what will help us establish consistent expectations statewide in terms of what the service looks like for HCP Care Coordination. So the 5 components are intake interview, the assessment of need, the development of an action plan created in partnership with the family, a 6-month review, and case closure as deemed appropriate. And so while you may already in your community be using some or all of these bullets in your own HCP process, what is new is that this is an expectation statewide so that all HCP care coordination services are following the same process. And so identifying these data points that will enable us to describe the population that we're serving and the service they've received is truly our first step in this incremental process of looking at and collecting data that will help inform our decision making and our program planning. So examples of data points that will enable us to describe the population, we will now, through the data that we collect through the HCCN data system, be able to describe the population by the average age of the child or youth served, the average period of time that they've been receiving the service, demographics around the percent of HCP care coordination clients that have insurance and what type of insurance, so other demographic data like that. And then in terms of the service that they've received through HCP Care Coordination, that really gets back to those 5 bullets that were on the previous slide, that every client that receives HCP Care Coordination service will have gone through that process, or those 5 bullets. So where are we going? Starting with fiscal year 12, we will be using the data to inform our state and local HCP program planning and evaluation. And there is a group called HPAC, which stands for HCP Policy Advisory Council, that consists of HCP team leaders and their supervisors. And the group is intended to focus on these planning and evaluation questions that will emerge from the data that we will be collecting. So ultimately, we talked about this first step in the incremental process being to capture that data about the population we're serving, and then secondly, describing the population they're receiving, and then ultimately, that what we need to do is to be able to demonstrate the impact of HCP care coordination. And so as we all know, during these tight economic times at both the federal and the state level, it's critical to be able to show that we are making a difference with HCP care coordination, and be able to quantify that for policymakers and funders. And it's important to acknowledge those who helped make this training possible, and starting with those HCP local offices and local program staff who provided initial and ongoing feedback to a state HCP program. We want local HCP staff to continue to provide us with feedback, and we value that feedback. In addition, we'd like to extend some thanks to those who piloted the intake interview form, and the revisions and suggestions that came from those who piloted and looked at the intake interview form really have made the interview form just that much stronger. And then to those who tested and retested again the CYSHCN data system. This is my first time being involved in the launch of a data system, and it is amazing to me how much testing and retesting needs to happen in order to get to the strongest product possible. So thank you to all of those who put time and energy into that. And then I'd like to turn it over to Ashley Juhl, who is an epidemiologist in our Epidemiology Planning and Evaluation branch. She is going to be talking about the data that we are collecting in the CYSHCN data system and how that will be collected through the intake interview form. So I will allow Ashley to step up here and introduce herself.
Thank you, Rachel. That was really informative. Again, my name is Ashley Juhl, and I'm an epidemiologist in our Epidemiology Planning and Evaluation branch, also known as EPE. Our branch is composed of a team of epidemiologists as well as a team of evaluators. Starting last January, so January of 2011, I, along with two other evaluators from the EPE branch, got to work with HCP in order to refine their HCP care coordination model and to develop the CYSHCN data system. So today, I'm going to discuss the basis for the data that we'll be collecting and what the data will tell us. I just want to tell you to please note that where you see CC on the slides, that means care coordination. So, the data charge was to reassess the data collection process. As Rachel just mentioned, the data will be collected in a consistent manner across the state. This process will allow us to collect data to describe and quantify the HCP care coordination client population statewide. This presentation will demonstrate how we will do this with the data that we will be collecting. We will also be determining data reports in future analyses with the data that we'll be collecting. And these data reports and analyses will help us to demonstrate the impact of HCP care coordination in Colorado. The data will help to describe the HCP care coordination client population. There are two types of HCP care coordination clients: those who receive care coordination with information only, and those who receive care coordination with an action plan. The data will quantify the HCP care coordination client population by determining the number of HCP care coordination clients who receive information only and the number who receive an action plan. The average length of services for HCP care coordination clients with an action plan can also be calculated from this data. In more general terms, the data will be used to identify who is using HCP care coordination services and to determine HCP caseload capacity. Additionally, we will be able to quantify community capacity for areas that care coordination assists with by identifying gaps in the data within different communities. I'm now going to introduce the major data collection tool, the intake interview, which is the first core component of HCP Care Coordination. After this presentation, Annie Whitehouse will walk us through the HCP Care Coordination flowchart, which will show us where the intake interview fits into the whole care coordination process. We used a framework that was used as a basis for developing our intake interview questions. This framework included the Maternal and Child Health Bureau core outcomes for children with special health care needs, the Maternal and Child Health National Performance Measures for children with special health care needs, in addition to the new state MCH priorities for Colorado. You have a handout in your packet titled Framework for Intake Interview Questions. This is just a one-pager that shows the 17 intake interview questions, and then it shows how they are related to the 3 components of the framework. These core outcomes and performance measures have data points that are calculated using a variety of different questions from the National Survey of Children with Special Health Care Needs, in addition to the Colorado Child Health Survey. Because of this, our next step from looking at the outcomes and the performance measures was to then look at the actual questions that made up these outcomes and performance measures on these 2 surveys. And for those of you who are not as familiar with the 2 surveys, I'm going to take 1 minute just to describe each of them. The National Survey of Children with Special Health Care Needs is a survey that's conducted every 4 years for children ages 0 to 17. There are 14 questions on this survey to help identify a child with special health care needs. And there are other questions on there to help determine issues such as health status, whether they have health insurance, and things like that. So we can then look at children with special health care needs on a variety of different issues. This survey is only conducted in states, so we only have data at the national level and at the state level. There's a chance that we'll be getting some urban and rural data for the state at some point. The Colorado Child Health Survey is our own homegrown survey for children ages 1 to 14. It started in 2004 and has been conducted every year since. We also use the same 14 screener questions from the National Survey to identify a child with special health care needs. And again, this Child Health Survey has pulled some of the same questions from the National Survey to allow us to assess our population. So we have data at the state level and at some of the larger county level and for some regions as well. So once we looked at these different surveys, we were able to pull questions that were applicable to the HCP Care Coordination model. We then adapted each and every one of these questions for our intake interview. So that means there is no comparable data between the national survey and between our survey. And additionally, because the outcomes and performance measures at the national level are comprised of a variety of different questions, we are not quite able to calculate those exactly because we did not include all of those questions in our intake interview. So for those of you who are not as familiar with the Maternal and Child Health Bureau core outcomes for children with special health care needs, I'm going to just show you the ones that we used in our framework. There are a total of 6 core outcomes. We only looked at 4, which were applicable to HCP Care Coordination. And those 4 include the first outcome, which is children with special health care needs whose families are partners in decision-making at all levels and are satisfied with the services they receive. And this is equivalent to the MCH National Performance Measure number 2. The second core outcome is children with special health care needs who receive coordinated, ongoing, comprehensive care within a medical home. This is similar to National Performance Measure 3. The third core outcome is children with special health care needs whose families have adequate private and or public insurance to pay for the services they need. And that's similar to National Performance Measure 4. And then finally, the fifth core outcome is children with special health care needs whose community-based services are organized in ways that families can use them easily. And this is similar to the MCH National Performance Measure number 5. And lastly, I did mention that in our framework we also included the Colorado MCH State Priorities. The one that was related to HCP Care Coordination was MCH State Priority number 6. And this priority is to reduce barriers to a medical home approach by facilitating collaboration between systems and families. I'm now going to quickly talk about the data collection process. The intake interview form is the tool that will be used for the majority of data collection. This standardized form will be used for all HCP Care Coordination clients at all sites across the state. It is important to remember that this process collects baseline data on HCP Care Coordination clients before HCP Care Coordination commences. Once we gather all the data needed on the intake interview form, it will then be entered into the SHCN data system. We will walk you through the data collection forms as well as the data entry fields in the data system later in this training. The intake interview form is divided into 3 data collection sections, which include summary data, intake interview questions, and then social determinants of health. I will now walk us through what data we will collect and give examples of questions that we can answer using the data that will be collected. We will collect more data on the clients who receive care coordination with an action plan because they are asked more questions than the HCP Care Coordination clients who receive information only. The bold text on the following slides indicates the data that will be collected on the intake interview form. If the bold text indicates one of the 17 questions on the form, the question number is included in parentheses at the end of the question. Additionally, where you see child or youth on the following slides, it really means the child or youth with special health care needs. So the first question we can answer using the summary data is, who are the HCP Care Coordination clients? So for those HCP Care Coordination clients who receive information only, we can look at how they are distributed by their age, by gender, by the language spoken in the household, and then by whether an interpreter is needed to conduct the intake interview. We can also ask the same question for the HCP Care Coordination clients who receive care coordination with an action plan. So we can look at some of the similar variables, including age, gender, language spoken, interpreter needed. In addition, we'll also be able to look at how these clients are distributed on factors such as single-parent household, age of biological mother, household education level, annual household income, household poverty level, race, Hispanic ethnicity, and then conditions of the child or youth. We'll also be able to answer the question, who needs HCP Care Coordination? One question, how many children and youth need care coordination, can be answered using question 1 on the intake interview form. And I should mention that we can answer these questions for both client populations. Question 1 is, does child or youth need HCP Care Coordination services? We can also, for both populations, ask, who else is providing care coordination, and is it sufficient? Questions 2 and 3 will help us get at that. Question 2 reads, is anybody else providing care coordination services for child or youth at this time? And then question 3 asks, is the current amount of care coordination child-youth is receiving enough to meet most or all of your family's needs? We'll also be able to ask the question, what do information-only HCP Care Coordination clients request? There is a question on the intake interview form that asks you to describe the information given to the family. So then we'll be able to look at what information HCP is giving to these information-only care coordination clients. We can ask, how are children and youth connected with HCP? There's a question on the form that asks, how did family hear about HCP? We will then be able to look at the distribution among both clients, so those clients who receive information only and those clients who receive an action plan, to determine how they heard about HCP. Because the clients who receive information only are not asked questions 4 through 17, the remainder of the slides pertain to the clients who receive care coordination with an action plan. So we can look at how children and youth access medical providers, or if they can access medical providers. We can ask how many children and youth have a personal doctor or nurse, and we can do this using question 4, which reads, do you currently have someone you think of as child or youth's personal doctor or nurse? We can ask the question, do children and youth encounter barriers to seeing a specialist or other medical provider? 2 questions help us answer this. Question 5 reads, in the last 6 months, did you or any doctor or nurse think child or youth needed to see a specialist for his or her medical conditions? And that's followed up by question 6. Was getting child or youth in to see a specialist or medical provider a problem for any reason? We can assess how do families perceive the coordination of healthcare for children and youth. We can ask the question, how is the communication among healthcare and service providers of children and youth? Question 7 helps us answer that. In your opinion, are there good communication and working relationships among all of the people who provide medical care and services? We can also ask the question, do families feel included in the decision-making process related to healthcare of children and youth? Question 8 helps us get at this. In your opinion, are you included in decisions made about child or youth's health care? We can look at the health status of children and youth. We can see if children and youth are missing school more often than necessary. Question 9 helps us with this. Question 9 asks, during the past 6 months, did child or youth miss school because of illness or injury? We can also see if children and youth are utilizing the emergency room more often than necessary. And question 10 asks, during the past 6 months, has child or youth gone to a hospital emergency room? We can look at how healthcare is paid for. We can ask the question, how many children and youth are underinsured or uninsured? 2 questions help us look at this. Question 11, does child or youth currently have any public or private health insurance? And then we can look at question 13. Does child or youth's health insurance pay for all of the health services he or she needs? We can also ask, what are the types of insurance among the children and youth? Question 11, in addition to question 12, help us answer this question. You already heard question 11, but question 12 just asks what the insurance type or types are that the child or youth is on. We can also ask, are families utilizing resources other than insurance to pay for care? Question 14 answers this. Are you using any assistance, discount, or charitable programs that help pay for the services he or she currently needs? We can also look at what families need. We can ask the question, do families need family support services? 2 questions help us answer this. Question 15, does anyone in your family need family support services? And that's followed by question 16. Is getting the family support services that you need a problem for any reason? And then finally, we can ask whether families need help managing health care and services. The final question, question 17, helps us answer that question. Do you need extra help to manage healthcare needs and services for child or youth? We can also analyze if reported needs, access, and utilization of healthcare vary by subgroups as defined by the demographic characteristics and social determinants of health that we are collecting. Again, we'll also be able to report the caseload numbers to look at our caseload capacity. We'll be able to look at the number of children and youth who complete an intake interview, the number of children and youth receiving an assessment, the number of children and youth receiving an action plan. Again, we can also look at the average length of time to complete the components of the HCP Care Coordination process. We will be able to determine how long it will take a child or youth to go from the intake interview through the assessment, the action plan, and then through case closure. And then just a quick bit about data dissemination once we've collected all this information. The data will be aggregated and reported out at the state level. HCP will be developing standard local report templates for county and regional reporting. Customized data queries will be available by request as well. And for those counties that have smaller populations, we might need to keep in mind that we might have to aggregate multiple years of data in order to get enough numbers to have meaningful information. So the data collection process will allow us to answer questions that will describe two HCP Care Coordination client populations: those who receive information only and those who receive care coordination with an action plan. We will also get a good sense of how many HCP clients belong to each group, in addition to how long clients receive services. The community capacity for successful care will also be assessed. That is all I have about the data collection and the data collection process. I would now like to introduce Annie Whitehouse, who will discuss the HCP Care Coordination flowchart. Annie is a registered nurse and the nurse consultant for the healthcare program for children with special needs. She is also the program manager for the HCP Care Coordination services in the Children and Youth branch here at the Colorado Department of Public Health and Environment. Please welcome Annie.
Thank you, Ashley. What an informative presentation. How interesting. We're going to be able to collect all this data in the coming years. I'm going to go over what HCP Care Coordination in its current form looks like. Please get out your HCP Care Coordination flowchart from your package, and I'll follow along with the slides. As you can see, this flowchart looks a little bit complicated, but we're going to start at the top and work our way down to the bottom, and I think that you will see that the new model of HCP Care Coordination is actually quite simple and quite simplified from the previous models that we have been using in the past. We start off at the top two boxes on the HCP Care Coordination flowchart. They say how the family or child or youth with special health care needs contacts the HCP office, or the HCP office contacts the family or youth. This is no change from what you're normally used to doing. For instance, the family or youth would contact the HCP office if they heard about us through the website perhaps, or maybe a provider would tell them about our office and recommend that they look at us in terms of care coordination. And the HCP office, for example, would contact the family or the child or youth with special health care needs when we get a referral from a physician or another specialty provider in the community. We could be responding to a CYSHCN, which is Colorado Responds to Children with Special Health Care Needs referral, which comes from the hospital and is referred to the HCP office to follow up on children who are born with any extra care needs that we can tell by the diagnosis. So we can look at the diagnoses of the children born in the hospital, and we have a select number of children that we'd like to follow up with because they're at more risk, higher risk than the average population of newborns. Once the person is contacted by the HCP office, or the HCP office receives a call from this family, we begin care coordination. Care coordination is, put very simply, is hooking the family and the child with special health care needs with services in the community, both medical services that they may need and also community-based services. That's our job. So in order to do that, we need to know who we're talking to when we start this conversation. That's why the next box says collect summary data steps 1 through 4. We don't need to collect too much data right up front, but we do need to know the child's name, the birth date, the gender, the caller's name, his or her relationship to the child, and the contact information, how to get back with that person or that family. We need to know the primary language spoken, and if the person's primary language is not English, we switch to an interpretation, we switch to the Spanish intake form or arrange for an interpreter. And we also need to know the county for service delivery reasons. Once we get that information from the person that we're talking to, and let's be clear, we could be talking to them on the telephone, but we could also be talking to them on face-to-face at the HCP office. We may be doing a home visit. We may be at a specialty clinic. So it's not just the telephone that this process is aligned to. It's any type of contact we can make with this family and the children. So once we ask if this person is here or talking to us for the reason of finding out about care coordination, we asked them if we could go over 3 questions from our intake interview. And those 3 questions, as Ashley pointed out, will be able to inform the care coordinator whether these children need or want care coordination from HCP. If you notice the green box, to the left of the intake interview question 1 through 3, this is the date the intake is completed, and this is when the child gets his registration number from the SHCN data system. As I said, care coordination will have commenced by that time. It commences right at the point where we start to take in those interview questions 1 through 3. If the person that you're talking to expresses an interest in HCP care coordination, but the questions 1 through 3 lead you to believe that they are really calling for information or resources from the HCP office only, we're going to go over to the right side of the flowchart and look at the information only box. This would be when the family is requesting information only from the HCP agency and does not need or desire HCP care coordination along with an action plan. In this case, we would provide the family with or youth with the information only, and we would go down this flow chart to where it says case closure and case closure date on the right. That means once the information is given to the family, we are able to close out this case. The case is counted as an episode of care coordination for any individual local public health office, and if you do need to open this case up again, it's no problem. You would start right where you left off at interview questions 1 to 3, where we're going to go next. We've just completed interview questions 1 through 3, let's say, and now the family is requesting HCP care coordination. We asked the family if they would be willing to participate in another questions 4 through 17, intake interview questions 4 through 17. when the family gives their permission to go to take this interview with them, the interview is completed. It can be completed in somewhere around 10 to 15 minutes with the family, and as I said, it can be over the phone or face-to-face. And then the HCP nurse or care coordinator will arrange a time to do an assessment of need with the family and the youth or child. The assessment of need date is filled out and entered into the computer system, the HCCN data system, and we proceed down to the next step, which is the action plan. The action plan is also filled out with the family and the child or youth and the care coordinator, and then we enter the date the action plan was completed into the HCCN data system. Care coordination from that point is per the action plan. From the action plan, you will have identified steps to be taken with the family and also with the other members of the medical home team and the care coordinator. And these steps may take intensive time with the family, or they may go along quite smoothly, having the family really have the guidance and being just mentored by HCP Care Coordination staff, and the next time we need to meet with them is 6 months. So anywhere between 1 and 6 months, we continue with the action, with the care coordination per the action plan. At 6 months after the action plan was completed, we need to review again the action plan with the family and child and youth, and we also need to review, of course, the assessment with the child or youth and his family, his or her family. The action plan is the critical document that you will enter into the HCCN data system, indicating that you have reviewed it. That is how we at the state will be able to track that care coordination is actually being done for each individual client at each individual agency. The assessment is also important to review, but that is more important to review for information purposes only. Although you do enter it into the HCCN data system, it is not tracked as intensively as these action plan initial and reviews are. This cycle can repeat itself over and over again as long as the assessment and action plan is reviewed with the family every 6 months and it is entered into the database. If the family and the care coordinator agree that HCP Care Coordination services are no longer needed, then we move over to the case closure, and we are simply able to close out that case and put a closure reason into the HCCN database. And as I said before, if the family comes back and needs further care coordination, we would simply open the case again. I'm going to turn this back over to Ashley Juhl. She's going to go over the HCP Care Coordination intake interview in detail. Thank you.
Thanks, Annie. What I'm going to ask you to do now is to refer to 2 documents that are in your packet. The first document is a 1-page. It's called HCP Care Coordination Introduction Talking Points. The second document that you're going to want to look at is an 8-pager called the HCP Care Coordination Intake Interview. The first core component utilized in the HCP Care Coordination process is the intake interview. The intake interview is a standardized form that ensures consistent use of the care coordination definition, as well as the questions that are asked to the families of children and youth with special health care needs. The form is administered in the same way to all families interested in HCP Care Coordination services across the state. It dictates who receives information only and who goes on to receive an action plan. The data collected with the form will be entered into the HCCN data system, and will be analyzed in order to describe and quantify the HCP Care Coordination client population. There are 4 main sections of the intake interview. There's the introduction, the summary data section, the intake interview questions, and the social determinants of health section. I'm going to show you the introduction. You will see that the introduction is mainly talking points that are to be used to assist the interviewer in describing HCP and its care coordination services. There are 3 sections in the introduction. There's the initial contact section, so section 1, the about HCP program and HCP services, section 2, and then the 3rd section is to assess the level of interest. Since these are talking points, these are just to be used as a guide. Feel free to customize them to fit whatever works best for you. There is one talking point that I will get to in a second in section 2 that we do want you to be true to when you're talking about the aim of HCP care coordination. So section 1 gives you talking points for the initial contact. There are 2 ways the initial contact can occur. The first could happen when HCP office contacts the family, so there's some talking points for you to utilize there, and again remember to customize these to however works best for you. The second part is some talking points for when the family contacts the HCP office. So again, customizable as needed. We have section 2, which gives us a variety of talking points to describe the HCP program and the HCP Care Coordination services. So all of those but the first bullet can be modified. I want to read the first bullet because this is the one we want to be consistent in using with all families every time we use the intake interview form. So this just describes the HCP Care Coordination aim, and I'm going to read it quickly. The aim of HCP Care Coordination is to assess the needs of the child and his or her family, empower and support the family in meeting these needs, and to improve the coordination of needed care. This just helps us maintain consistency in describing care coordination by HCP. And then finally, you can see section 3 just gives a few talking points about how to assess their level of interest before continuing on with the remainder of the intake interview form. And I just want to mention that this, I think a laminated copy of this introduction will be provided to you so that you can keep one at your workstation, or so if you are doing home visits, you have a nice copy to take with you. We're now going to transition to the summary data. This is on page 1 of the HCP Care Coordination Intake Interview questions. There are 4 steps in the summary data section. Step 1 is to collect the client information. So here you're going to collect the last name, first name, middle name, a suffix if applicable, the gender of the client, in addition to the client's birth date. Step 2 is where we're going to collect information about the family member. So here you're going to record their last name, first name, middle name, a suffix if applicable, their gender. Then you're going to record what their relationship is to the client. You're going to check if this family member is the legal guardian of the client. You're also going to determine the primary language spoken by the family member. And then you're going to indicate whether an interpreter is needed to complete the remainder of the intake interview. Page 2 is where you're going to find step 3 of the summary data section. And I want to draw your attention to the top of page 2. You'll see there's a section for you to enter the last name, the first name, the date of birth, and the gender of the client. You will see this on pages 2 through 8. Please use these data fields and fill them in because we want to be able to put this packet back together in case a page or 2 gets loose. So we need to know what client this information is for. So step 3 is to collect the address information. So you need to get the address for the HCP Care Coordination client. You also have a space to put in an address for the family member if there is a different address. It's really important that you indicate which address is the primary mailing address in case you need to send something to that family or to the client. Step 4 is where you're going to collect some contact information for the family member. Here you can record phone numbers. If you do record a phone number, please make sure that you indicate the type of phone, so whether it's a house phone or a cell phone or a work phone. Additionally, you'll be able to collect an email address for the family member if they want to give you an email address. The most important thing is to check which contact method is preferred by the family member. You will also see at the bottom of the second page there's an area where we're going to collect a little bit of information about the intake interview. So here we're going to record the intake interview method, and then we're also going to record the interviewer's name and their title in addition to the date that the interview occurred. This information just helps us to understand the most efficient way to complete the intake interview. We're going to now transition to page 3, which is where the HCP Care Coordination intake interview questions start. I want to draw your attention to the top of that page. Again, you'll see where the last name, first name, date of birth, and gender of the client should be entered. And right below that, you'll see a box to record the date that you're completing the intake interview, so make sure to fill that out as well. In the blue box, you'll just see a talking point that again helps us to be consistent in describing what HCP Care Coordination is, so make sure that you read that again and help the family member or client understand what HCP Care Coordination is. We then have the 3 questions that will help determine whether the client is just going to want information only, or whether the client is just going to go on and receive HCP Care Coordination with the assessment and the action plan. So the first question, does child or youth need HCP Care Coordination services? We have 4 answer categories to select from. These include yes, no, don't know, not sure, and refused. And just to note, if you cannot get a yes or a no answer, and the respondent really does not know or is unsure, then go ahead and select don't know, not sure as your answer category. If the respondent flat out refuses to answer the question, then go ahead and check refused and continue if possible. These 2 answer categories might feel more subjective in how you answer them, but please just try to maintain the same subjectivity across the remainder of the intake interview questions. We then proceed on to question number 2, which is anybody else providing care coordination services for child or youth at this time? We have the same 4 answer categories, yes, no, don't know, not sure, refused. Here you will see our very first skip pattern. So if the answer to question 2 is no, don't know, not sure, or refused, you're then going to skip the follow-up question to 2, you'll skip question 3, and proceed directly to page 4. If the answer to question 2 is yes, we have a follow-up question that will be asked. And that question is, who else is providing care coordination? And you'll see here that we have 12 answer categories to select from. There will be instructions on your form to only choose one of these answer categories. We then proceed on to question 3, but please remember to only ask question 3 if the answer to question 2 was yes. Question 3 reads, is the current amount of care coordination child or youth is receiving enough to meet most or all of your family's needs? Here we have the same 4 answer categories you're familiar with by now. Yes, no, don't know, not sure, refused. Children and youth with special health care needs or their families who decline HCP Care Coordination services and only need information, who decline the full set of care coordination services and only really need information only, are to be marked as yes under client requesting information only on page 4. You will then indicate how the family heard about HCP, and then you can indicate the information that was given to the family. At the bottom of that page, you'll indicate no, that you're not going to proceed on to questions 4 through 17. You're then going to close this case, record who's closing the case, and then record the date of case closure. Once this is all said and done, you're going to enter the summary data that you just collected in addition to questions 1 through 3 into the HCCN data system for these clients who receive care coordination with information only. For those clients who are going to receive care coordination with the assessment and action plan, at the top of page 4, you're going to indicate no to client requesting information only. You're then going to indicate how this family heard about HCP, going to skip the requested information box and continue to ask questions 4 through 17. Once you've completed the entire intake interview form, you will then enter it into the HCCN data system. Again, there are some talking points throughout the intake interview form. These will help provide you with some suggested conversation with the family. For questions 4 through 17, they will be in boxes in italicized text, and we will go through them here in just a sec. You will also see that there are some comment sections in boxes to the right of each question for 4 through 17, and these are just areas that allow the care coordinator to jot down notes as needed. So the first question that the care coordination population with an action plan is then asked is question number 4, which is, do you currently have someone you think of as child or youth's personal doctor or nurse? And here we have some guidance text, so that's what the italicized represents. And this text we have prepared for you is, a personal doctor or nurse is a health professional who knows child or youth well and is familiar with child or youth's health history. So for this question, we can answer yes, no, don't know, not sure, or refused. We then proceed on to question 5. In the last 6 months, did you or any doctor or nurse think child or youth needed to see a specialist for his or her medical conditions? There again we have italicized guidance text which reads, specialists are doctors like geneticists, surgeons, heart doctors, neurologists, allergy doctors, or any other doctor that specializes in one area of medical care. We can answer from the 4 answer categories. Again, we have another skip pattern here. So for those who answer no or refuse to answer, we skip question 6 and proceed to question 7. But for those who answer yes or don't know, not sure to question 5, we then just proceed on to question 6. And question 6 reads, was getting child or youth in to see a specialist or other medical provider a problem for any reason? There are 4 answer categories here. Yes, no, don't know, not sure, refused. We then have question 7. In your opinion, are there good communication and working relationships among all the people who provide medical care and services? We have 5 answer categories for this question, and these include always, sometimes, never, don't know, not sure, refused. We then have question 8. In your opinion, are you included in decisions made about child or youth's health care? We have the same 5 answer categories you just saw. Always, sometimes, never, don't know, not sure, refused. Question 9 asks, during the past 6 months, did child or youth miss school because of illness or injury? We have 5 answer categories: yes, no, don't know, not sure, refused, does not go to school. There is a follow-up question to question 9 for those who answer yes. Depending on the number of days they indicate of school missed in the last 6 months, you're then just going to select a range. Select the range for which their answer falls into, and you can select from 5 days or less, 6 to 10 days, more than 10 days. We then proceed on to question 10. During the past 6 months, has child or youth gone to a hospital emergency room? Yes, no, don't know, not sure, refused are your answer categories. And again, we have a follow-up question for those who answer yes to number 10. And that follow-up question reads, how many times in the past 6 months? And then you will just jot down the number that the family gives to you. We then have question 11. Does child youth currently have any public or private health insurance? You can answer from the standard 4 answer categories. Here we have another skip pattern. So for those who answered no, don't know, not sure, or refused for question 11, we skip questions 12 and 13 and go on to question 14. If the answer to question 11 is yes, we then proceed on to questions 12 and 13. Question 12 reads, and just a reminder that you only ask question 12 if the answer to question 11 is yes. But this question just asks about the insurance types that the child or youth is on. You can answer Medicaid, CHP+, private insurance, TRICARE, other, don't know, not sure, or refused. For those who answer Medicaid, there is a follow-up question, so please pay attention to this and make sure to choose or select the type of Medicaid that they're on. You can choose SSI, waiver, HMO, or straight. Then proceed on to question 13, which, just a reminder, you only ask question 13 if the answer to question 11 is yes. Question 13 reads, does child youth's health insurance pay for all of the health services he or she needs? You can answer yes, no, don't know, not sure, refuse. Again, there's another skip pattern here. So for those who answer yes to question 13, you skip question 14 and ask question 15. But if the answer is no, don't know, not sure, or refuse to question 13, you then proceed on to question 14. So for question 14, this is only asked to those who answer no, don't know, not sure, refused to question 11, or to those who answer yes to question 11, but no, don't know, not sure, refused to question 13. Question 14 reads, are you using any assistance, discount, or charitable programs that help pay for the services he or she currently needs? You can select from our standard 4 answer categories. We then proceed to question 15. Does anyone in your family need family support services? And here we have some more guidance text for you. Support services include services such as educational groups, family support groups, respite care, transition support, and where that bold brackets and text are, please go ahead and add any other family support services that are specific to your community into this talking point guidance text. Again, to answer question 15, you can select yes, no, don't know, not sure, or refused. You have another skip pattern here. For those who answer no or refuse to answer question 15, you skip question 16 and ask question 17. If the answer to question 15 is yes or don't know, not sure, please proceed on to question 16. So again, just to remind you that you only ask question 16 to those who answer yes or don't know, not sure to question 15. Question 16 reads, is getting the family support services that you need a problem for any reason? And you can answer yes, no, don't know, not sure, refused. And then finally, we have the last question in the intake interview section. Question 17. Do you need extra help to manage the healthcare needs and services for child or youth? And here are some more talking points. Managing healthcare services includes things like making and keeping medical appointments, making sure child or youth doctors or nurses have his or her most current medical information, or organizing child or youth's other specialist appointments. And for question 17, you can answer yes, no, don't know, not sure, refused. Following question 17 is an area to indicate whether the family would like to proceed with HCP Care Coordination, including the assessment and the action plan, which are required. There's also some lines for notes below just to note the family's priorities for care coordination. The last section of the intake interview is to collect information on the social determinants of health. This is page 8 of the intake interview questions. Some of you may feel more comfortable asking these questions later in the process. You may want to ask these questions at the assessment, and that's perfectly all right to just tear this page off and take it with you to the assessment. It's just really important that you remember that once you get this information, you do need to enter it into the SHIN data system, as social determinants of health is required in the SHIN data system. So again, you'll see that at the top of this page, we have the area for you to enter the information about the client. Especially important if you are separating this page from this intake interview packet so we know who to return it to. You can also see some talking points in the blue box at the top just to talk a little bit about why the social determinants of health are being collected. And then you can see what we're collecting. So this starts out asking about whether the child or youth resides in a single-parent household, and you can answer yes, no, don't know, not sure, or refused. We then ask about the age range of the biological mother at the child's birth, and you can indicate whether this is 16 years or less, 17 years or older, don't know, not sure, or refused. We then try to assess the highest education level in the child or youth's household, and you can select from 8th grade or less, some high school graduate, some college graduate, don't know, not sure, refused. We then want to try to determine the number of adults in the child or youth household and record it on the line provided. We then want to determine the number of children in the child or youth household and record that on the line provided. We want to record the annual income in the child's household. And these three things, the number of adults, the number of children, and the annual household income, help us to calculate poverty level. The poverty level, luckily you don't have to calculate that yourself. Once you put that information into the SHIN data system, the data system will actually calculate the poverty level for you. We then follow that by trying to indicate the race of the child or youth. We can select from Caucasian, white, African American, black, Asian, Pacific Islander, American Indian, Alaskan, other, don't know, not sure, refused. And although you don't see it on this page, we are putting in a section to indicate whether the child or youth is of Hispanic ethnicity. So you'll be able to indicate yes, no, don't know, not sure, and refused there. So just a couple points before I conclude. The soonest point at which you can enter information into the SHIN data system is after the intake interview form is completed. It was not HCP's intention to have the form entered into the data system concurrently, but after you get used to the data system in the form in a few months, you may feel just fine entering the data at the same time you're collecting it. We just want you to be aware that wasn't our original intention for right now. So that's all I have to present about the intake interview form. I'm going to go ahead and invite Annie back up. She's now going to talk to us about the assessment, the action plan, the 6-month review, and case closure.
Thank you again, Ashley. That was a very nice presentation. It made the the intake interview quite clear, and hopefully people understand the reason that we're asking all these questions of our potential clients or of our clients. Hopefully they understand now the reason, what we are going to be able to collect in terms of information and what we're going to be able to report out on, and ultimately what we are going to be able to change, use to change our program, develop a better program than we already have. I'm going to continue and talk about the assessment after Ashley's just talked about the intake interview, but I do want to allow a little bit of time just to have people write down any questions they might have while we're going through this presentation. And I want to give you my address, my email address, because I'm the HCP Care Coordination Program Manager. That being said, my address is ann.whitehouse@state.co.us. My phone number is 303-692-2327. I've worked at the State Department of Public Health for about a year now, and before that I was working in international public health. Prior to that, I have been a nurse doing quality management, and prior to that I worked at community clinics such as People's Clinic in Boulder and others in the Front Range. And prior to that, I probably won't go on. I've had 30 years of nursing experience. I showed this picture because it was just a particular interest to me in terms of how community, family, and the help that we can offer them really go together. This was a young man in Russia, or actually a former USSR state called Abkhazia in Russia, and he spent 2 years in this particular hospital, which I was the head nurse in, with MDR-TB. And I really realized that it was important for nurses and care coordinators such as us to really try to hook these people up with community resources and services, because they really are quite disadvantaged when they've been out of that loop for so long. So I just want to applaud everybody's work and let you know that I too am a children's person. I have children all over the world. These are a group of children that I mentored in Eastern Europe as well. I like to see things from both sides of the bank. I'm a good listener, and I am a good learner. So I'd like to work together with you in making this program, HCP Care Coordination Program, strong. I've perceived that the HCP Care Coordination team players, state and local, are a really well-balanced team. There are people with long-standing experience with the HCP program, and then there are more recent contributors to the HCP program, all combined to make the richness and the depth of the services that we provide. We're all family-centered healthcare professionals, and of course we're all dedicated to improving the health and wellness of children in Colorado. I'd like to take this time to offer my gratitude to Barb DeLoyne, Dr. DeLoyne. She came before me as the Healthcare Program for Children with Special Needs Care Coordination Program Manager. She gave me a great handover, and we're still working with Barbara on, she's one of our local partners in things such as newborn NICU, newborn intensive care, discharge planning, and care coordination. So she's still very active, and she left a great program in her wake, which I was lucky enough to receive. Let me review upon completion of this training what you should be able to do. You should be able to implement, you should be ready to implement the HCP care coordination process, including the 5 components. We've talked about the intake interview. I will talk about the assessment, the action plan, the 6-month review, and case closure. Start with talking about the assessment. Please get out your assessment form from your package of information. As you know, the intake interview has 17 questions, and you will have already started to build a rapport with your family during the intake interview. But let me point out that the intake interview can be given by anyone who works for HCP. It could be an HCP staff that's a technician. It could be a family-to-family person. It could be an RN. It could be a social worker. It could be even a dietitian. This information that we've collected in the intake interview portion of the interaction is not clinical, and it has no personal health information. Moving in towards the assessment has personal health information. So, of course, we continue this foundation of building safe and trusting relationships with our families. We listen to the families' questions and concerns. We point out during the intake interview that these questions and concerns they have will be discussed more fully with a healthcare professional in the assessment phase. So you elicit the questions, and then their further questions will depend on the particular concerns they have. We're trying to help optimize the formal and informal family support systems and work towards the development of the family's medical home team. Some questions to consider as the HCP Care Coordinator. What are some of the strengths of this family? What are some of the concerns of this family? What are some of the goals of this family? We're going to use the common assessment domains during the assessment process: child and youth health, child and youth development, family well-being, psychosocial status, basic needs, community and family supports. As you can see, the assessment is broken out, the domains are broken out a little bit differently, but they cover the 6 domains that was on the previous slides. The domains now include family, strengths, and concerns, and I want to stop here for just a minute and emphasize strengths. We are really not just doing an assessment of need on this family, but we're also doing an assessment to find out what this family's strengths are and how have they been coping with the issues they've been dealing with, and the concerns they have that they have not been able to cope with or need further help. Most people want right away to know about the insurance status of a particular family, so that's second. Let me point out at this point that these domains do not have to be asked in this order. As we discussed in the previous slide, we're relationship building with the family, and we're using interview techniques that honor this family's strengths and concerns. So if they want to go clear on and talk about the children and youth special healthcare needs medical situation before they talk about insurance, that's fine. This assessment is just a template, and it will be available to you and your public health agency in an editable form where you can change the order of the domains around to suit yourself. Another domain that we will be assessing is developmental status of the child or youth, and then the emotional status of the child or youth. I'd like to point out 2 things now. There's a comment section on the right hand of the assessment form. This comment section is used, as Ashley mentioned, for the care coordinator to jot down any notes. You may be a different person who will carry on with the care coordination, so you're giving information to another person, or you're jotting down notes to remind yourself about some specifics the family said or concerns they had. On the left-hand side, there's a section called AP. That stands for Action Plan, which we'll review later. But we will check this area in the AP column if the item that you're talking about, the domain or subdomain, will carry over to the action plan. For instance, let's look at speech in CYSHCN developmental. If this child, let's say, and the family has comments or issues about the child's speech development patterns, you could jot down those particular comments there, And if it's something that you're going to want to work on with this family through the action plan, you would make a check to the left in the AP column. Another domain are the therapies this child or youth may be receiving: occupational therapy, physical therapy, speech and language pathology, vision, behavioral, mental health specialists, or other therapies such as massage, recreational, or developmental. I do want to point out that the forms you will be receiving and that will be available on the HCP website are a bit different. This is an earlier version of the assessment form, so they're a bit more refined, and don't be alarmed if these domains or the subdomains aren't in the complete order they are in this teaching module. Another domain we'll be looking at is the child's educational status, what school the name is that they go to, the grade they're in, if they need any special individualized educational plans, are they receiving or do they need special education? How is transition, if that's applicable? How is the transition being planned and enrolling? And what is their particular learning style? We also assess basic needs: housing, electricity, phone, clothing, food, family planning, financial status or income, and employment. And then lastly, we look at community resources. What other resources are they using? What are they using with good results? What do they not know about that our care coordinators need to connect them with? Do they need child care preschool, early intervention services, Part B services, child find evaluation? Do they need to be connected to a community center board or family services support program or a community support group? Does this person need vocational rehabilitation? Do they need anything from the Department of Human Services, Public Health? Are they using faith-based resources, legal issues, and other? You'll have other to write down in community resources because this will be a list that's unique to your own community. Again, let me emphasize that each individual local public health agency can change this form as they see necessary. They can't delete the domains that are already on here, but you can certainly change them around or add to them. Additionally, in the assessment, we will ask about the child or youth's medical conditions. You will see on the last page of the assessment form a list of over 50 medical conditions common to children and youth with special health care needs. This is required to be entered in the SHCN data system, whereas the rest of the assessment is not required to be entered. Only the name of the child and the date that you did the assessment and the name of the staff person, HCP staff person, is required for entry into the SHCN data system. These medical conditions were taken from national survey questions and from providers such as myself and others who had many roundtable discussions about what this list should look like. I want to point out that the ICD-9 codes are still optional entry into the CYSHCN SHCN data system. We are moving away from using ICD-9 codes and moving into using medical conditions. But for those agencies who still would like to use ICD-9 codes, there is a space on both the assessment form and there is room in the SHCN data system to enter those codes. This is the medical conditions form. As Ashley mentioned, social determinants of health can be asked either during the intake interview process or during the assessment process. Personally, as a nurse, I would tend to ask this during the assessment process because the relationship is stronger at this point and you've built some trust and these questions are somewhat sensitive. But as an individual practitioner, it will be up to you in when you want to ask these questions of social determinants of health. It's very important, though, that you do remember if you ask them during the during the assessment form routinely, you must go back and enter them into the HCCN data system when you enter the date of the assessment being done. So what is required on the assessment? It is required that the HCP Care Coordinator does an initial assessment with the child or youth and their family. You must enter the assessment. You must enter into the HCCN data system the date of the assessment, the HCP staff name and title, and the medical conditions of the child or youth. The assessment is kept in the child's record. The record is either paper or electronic medical record. The assessment, it is required to be reviewed every 6 months and updated as needed every 6 months. And you will use the information from the assessment to create your action plan. What is optional on the assessment? With the form, it is optional, as I've discussed, to use the assessment form exactly as it is. The form will be sent in an editable version. It is a template for your use. You cannot delete any information that we're currently collecting on the form, but you can add or change the order of the domains in the assessment form. It is optional to fill in every blank space. That might come as a surprise to you, but this assessment form is really a work tool for the care coordinator. And we at the state know when you do your assessment with the child or youth that you will consider all these facts, all these domains and subdomains. But we recognize that you only need to write something down in the box that says comments if there is something applicable or pertinent or something you want to carry over into the action plan. You may use this form or prior versions of HCP assessment forms, which are located on the HCP website. We'll move towards discussing the action plan now. Would you please take that out of your packet? The purpose of an action plan, of this action plan, is to be a plan between the family and the care coordinator to determine and document the goals, the next steps, the persons or people responsible for taking those next steps, and the target dates. There's also an area where you can check if the step was taken. So otherwise, if this goal has been met or if the steps were taken, you can check off so you don't always have to review the particular goal or next step if you see a check mark in the last column to the right-hand side. It's a plan for follow-up every 6 months or less. It's very important that this action plan is reviewed every 6 months, and HCP, the state, HCP office, will be sending each and every local and regional office out a report of who is due for follow-up in a timely manner. The action plan identifies specific activities for the family care coordinator, for the family and care coordinator, and note this, please, other members of the medical home team. It's not just for the family and the care coordinator. The care coordinator will have the opportunity to engage the family in identifying other medical members of the medical home team that might be responsible for next steps. The action plan sets an achievable and realistic timeline, and it is intended to be a family-friendly takeaway document. A copy of the action plan will stay in the person's chart, but the family and the child will always walk away or be given an action plan by the care coordinator. And as we've discussed, the action plan includes the prior information you've gathered from the intake interview and assessment. The action plan is conceptually being used within the medical home approach. HCP Care Coordination has a huge job to perform. We are providing a key part of the medical home approach for each patient or client and their families. We are trying to integrate and connect the client and their families to specialty care, oral health, mental health, recreational services, educational services. So this action plan is a way to tie these steps up and and who would be responsible for doing which type of communication moving towards meeting the family's goals. Here's a picture of the action plan. As you can see, it's a very simple document, and this again this is in the last process of revision, so you'll get even a better document on the HCP website in November. The action plan has only a couple things that you need to fill in besides the goals, the next steps, the person's responsible, and the target date. You need to fill in the date the action plan was completed and who it was completed by and with which family member it was completed by. And then you need to fill in the 6-month action plan review date for the family's information and your own. Lastly, you need to put in your telephone number, how you could be most easily reached, because realizing this is a family-friendly takeaway document, it would be very nice for the family to have this information on the action plan with them at home. We talked about goals, next steps, persons responsible, and target date columns. I urge you to try the action plan, play around with it in your individual agencies, and use it as a tool it was intended for, to be a family-friendly takeaway document that integrates community and family within a medical home approach. What is required on the action plan? An initial action plan is created with the family is a requirement. An action plan review every 6 months or less. The family obtains a copy of the written action plan. You can get the copy to them by in person, of course. You can mail them a copy if you're doing a telephone assessment and go over it with them on the phone. It's up to the individual care coordinator and their agency to ensure that each family obtains a copy, but how they obtain a copy is up to you. You must enter into the HCCN data system the date of the action plan creation, who completed the action plan, the HCP staff name and title, and the date the 6-month review is completed. And then, of course, if you have another 6-month review and another, you need to keep up this process of entering into the HCCN data system the dates that the 6-month reviews have been completed. What is optional? You may redesign this action plan format to suit your or your agency's needs. The important thing to keep on the action plan, though, is the information that's existing. But if you wanted to add or modify anything on here, you're free to do that. It is optional, as I mentioned, how you give the action plan to the family. Lastly, speaking about the action plan, I hope you can see how the action plan is a potential tool to integrate family and community. I wish you good luck in using the action plan and the assessment, and we'll sign off here and just talk about, on completion of this training, you should be able now to do the intake interview, the assessment, the action plan, and we will continue to talk about the 6-month review and the case closure. Moving along to the case closure, we discussed it previously when we were looking at the HCP Care Coordination flowchart. Case closure is done when it is deemed necessary by the care coordinator and the family and the child and youth, if applicable. If they do not need HCP Care Coordination services anymore, we urge you to close the case. If they do need HCP Care Coordination services, then you will just continue in the cycle of doing your 6-month reviews and performing care coordination per action plan. Case closure simply means that in the SHCN database system, the case is closed, but when you go to reopen it, they will be reopened with the same identification number and just a different episode of care. The HCP program goals specific to care coordination are that we do coordinate our state and local efforts. We're seeking to achieve statewide standardization of the HCP Care Coordination program while maintaining the individual identity of each and every unique local public health agency. We have employed and will continue to employ evidence-based best practices. We will continue to improve our standards of practice, and we have and we will continue to make a difference for families, providers, and local systems. This ends my presentation, and this is a slide that an image. I wonder if you feel like you're moving into the darkness or coming out of the darkness. I hope it's coming out of the darkness, and I hope the system serves you well. And do please communicate with me if you do have any questions or comments about the HCP Care Coordination program. Thank you. If you do have additional questions, email them to me. I already gave you my email address. It's ann.whitehouse.state.co.us. Be thinking about how you will implement the care coordination model and use the SHCN data system in your office. And we'll talk about next steps we'll talk about the next steps at the end of the presentation, and so you'll have more contact information than just mine that is given to you in the next steps handout. I'd like to introduce Dale Nakamis, the data coordinator for the integrated data system at CDPHE. Dale and I have worked closely on the development of the SHCN data system, and he is the person that you will be talking to as the data coordinator or resource person, help desk, so to speak, if and when you do call. So let me turn it over to Dale.
Thank you, Annie. I really appreciate your help in getting the system off to a good start. So to begin my work with you this afternoon, or whenever you're viewing this, we will begin by concentrating on what we call the SHCN data system in a training environment. I've got a number of screens to go through with you. It'll probably last about a half hour. And when you begin your session on the browser, you will come up with this opening page. Just to review a little bit, the CHIRP system that we're migrating from was not a true web-based application, and it required a system called Citrix for you in order to run the CHIRP application. In contrast, this data system that we're implementing is a true web-based application, and you run it directly from the browser. Just to go into a bit of the requirements for the SHCN data system, you do need to have at least an Internet Explorer version 7 in order to run SHCN, and we also support version 8 and version 9. When you first begin your SHCN system, then you will see this opening page, and I'll just call out a few points to look at first. If you click on the right-hand side of your screen, learn about, need information, these are essentially information points for you only, and then you move into other directives like needing access to the program to actually get the user account set up, as well as accessing the program below that. So for instance, if I wanted to contact our staff, I would click on that icon, and then I would get some program contacts to come up on your left-hand side of your screen. I'll call out the help desk number to your attention. It's shown there as 303-692-2384, which will ring directly to my desk. So I want to begin by just sharing with you how you can access the program. In order to access the program, whether it be in training, which is what you see right in front of you now, or whether it be in production, you must first identify your last name, first name, middle name, etc. in this first screen. I'll just do a quick one to demonstrate how it leads to the next screen. The middle name is technically not required, so you can skip that. The email is going to be very important in that the email that you list here will be the same email that will receive the welcome with your username and temporary password on it. For the security question, you can use the drop-down arrow on the right and select any one of these 10. When you key in your security answer, it will be case sensitive. Program request will be the healthcare program for children with special needs. Once you do that, you will have a site request that you can choose below it. At this time, only choose one site. Those of you that may have additional sites that you manage will need to have an email from you addressed to me to request those additional sites. A future enhancement will allow you to choose more than one site request in this screen. When you've completed these answers, go ahead and click on Send Request. You're going to be presented with this confidentiality agreement page, which you must click on Agree to the above terms. And then if you scroll down a bit, you can click on Agree. At that point, you've got your request successful message on your left, and then I will be able to get that request in my user administration menu, and I'll review it with Annie and Shirley. The next step on this would be, as soon as I approve that, then you will receive the email message from CDPHE indicating your username and your temporary password. You have up to 72 hours from the time that email is generated to log into the link that's going to be in the email and actually use the temporary password and then change your password. So again, you've got up to 72 hours from the time you receive that email in your inbox to act upon it. To leave this screen, you just click on Home, and then you're presented with your main screen. We call this the HCCN IDS portal screen, which allows you to move into different applications. I'll just point out before I leave this, we do have other programs that are supported. The newborn hearing, newborn metabolic, etc. down the side. The last couple are going to be implemented at a later date, but yet, as you can see, they all will be accessed through this main portal. The other 2 points I wanted to point out real quickly on this screen before I go into the actual HCCN data system is going to be the can't access your account link, which is just below the login area of your screen. If you go in here, you've got a few different radio buttons that you can select to help you through the login process. I'll pick probably the most common one. I forgot my password, so just go ahead and identify that. And like most systems these days, we allow you just to identify your username, and then we'll ask you to verify the code that's below that so that we are assured there's a real live person making this request. And then once you submit this, you will be able to get help in your email inbox to actually get that password reset for you. So this would be used in lieu of calling me or the help desk number, if you will, to get you back into the system. And as you can see, there are other choices in here that will help you as well. Some of these do require you to actually call me, but most do not. Backing up to that home portal again. The last link I'm going to show you is requesting a new user account. This is the one that I just showed you before. It's basically the same information being asked a little different way. So moving into the SHCN system now, will require you to key in your username and your password on the right-hand side of your screen. Username is not case sensitive. The password is case sensitive. So the minute you log into the new SHCN data system, you'll see that it is pretty clean in its format. It doesn't have a lot of extra things to clutter up. You are left, or you're starting the page with your personal information. If you notice on the right-hand side of your screen, the site access is going to be the area of responsibility that you will be working on for your clients. If you wanted to update any information within personal information, such as your user first name or last name, email, etc., you can do that just by clicking on Update, and it'll present you with those pieces of information. The orange highlighted fields are those that are required, and that's a pretty consistent theme throughout SHCN. Since these look good to me, I'll just cancel out of here. The next area I wanted to point out real briefly is the confidentiality agreement. If you click on that, this gives you a nice way to review it. And then if you wish, you can print it just by clicking on the print agreement. And then you can identify a printer or the document writer if you wish to save it there. To leave the screen, you actually have to do a back arrow, which is not too common in SHCN, but it can be used in certain places. Real quickly, changing your password, pretty important panel to go into. I just click on Change Your Password. Here, like you'd probably guess, you're just going to identify your old password, new password, and go ahead and confirm it. We do provide the directions about length and type of data just below the panels. Clicking on Security, we go to the next panel, and here you're going to identify a different question and answer combination, which you may want to do from time to time. Toolbar options is pretty important in that you can identify certain things to appear up in your top menu bar. If you look up in the favorites area, last 10, close all tabs. These are the three that I find most helpful, and we'll discuss those in a little bit. But essentially, you can open it up to other things too, down below. Just click or unclick to activate it. Managing my favorites is another enhancement to this system over Chirp. What I've done here is create 3 folders, we call them, and just by clicking on the plus to expand, you can see that I've put certain test clients within these folders. And it's just a convenient way for you as a coordinator or as a staff member to quickly work with clients. Similarly, we could go ahead and delete if we wished, just by highlighting it and then clicking on delete. Since I'm good with those folders, I'll come back to my personal information, which is your typical starting point when you log into HCCN. And I'm going to move into the actual screens that you'll be using day in and day out. To do that, we go to one of about 3 different places. I'm going to show you first how you go to the Search tab, which we can either click on here for search, or I can go to the option menu and click on search. So when I click on the search, I come up with my basic method of finding a client. And like CHIRP, this is our first step in working with clients or even adding clients. We go to the client search. And I'm going to point out over on the right, you see there's all site as well as all status. All status is the default for you, so it is checked. I like to work with all site also because when I'm doing my searches for clients to either bring one up or to make sure there's one there or not there for a new client ad, I like to see all sites in my query. So I click on this check mark. When I go down and identify the particular fields I want to search upon, I usually go to last name. It is not case sensitive when you key it in. And you can identify multiple fields to search upon. I'll just use last name for now. And then click on search. I'll go out and search for everything within the HCCN data system. You'll notice that this one is highlighted in red, which basically means that the status of this one is inactive. And Annie had talked about that a little earlier in the presentation, how clients could become closed. And this is an example of a closed client or non-active client. At this point, I have a choice. If I want to bring that person in and actually look at that client and do some modifications or intents or analysis on that client, I could just click on load. And that should bring the client up into my, what we call our first tab, which is defined by this area right up in here. From here, I can do a lot of different things, like the CHIRP system that you're used to. If you look on the left-hand side, there is what we call the tree, or its branches down below. And if you just click in one of its branches, you can get information about it or about the client. For instance, I could see address information by clicking on the address branch. Then I go into view, and I can take a look at its information for address. Within this HCCN data system, they have programmed a way to move around very quickly. You do not have to just cancel out of a given screen. Instead, we just go into either another search or into one of the tree branches over here on the left to leave the current screen we're in. What I'd like to do now is go and search again for a different client, and this time a client that I want to add. So I'm going to go in and key in a last name that I know isn't there, or hope is not there. And then, like before, I can either click on All Site and then click on Search, or take that off. So I'm going to leave it on. Do my search. And sure enough, I came up with a search results of no records found, which is what I was hoping for. So now I'm going to go into what we call our Add Client wizard by clicking on Add Client. I'm going to go into the first step, of which there are 4, plus a summary at the end to show you your data before you actually save it to the HCCN data system. And as you can see, there are just a few fields that are highlighted, in other words, required. So I'm going to go over to those right away since we're demonstrating this. You'll notice that site has been highlighted to be Denver, and for this test user, TUser1, that's the only site I've got identified for TUser. Some of you that may have more than one site, you will have a drop-down that you can select more over here. Since I don't, I'm just going to go to my next to add family members. Mary happens to be the legal guardian, and I'm going to select mother for that person. Here I've got a choice of either adding a family member by clicking on this link where the mouse is pointing, or I can just click on next, in which case the system comes out and says, all right, I want you to validate this. You haven't told me you're going to save it. Do you want to actually add this Mary mother to your household or not? And I'm going to go ahead and say yes, I do. If I clicked on no, it would go to step 3, but it would not have Mary in its area to add at a later date. So I'm going to say yes, and now identify address information. If I want to add a second line to this street for the client, I'm going to just press my Enter key. Additional information is almost like a notes sort of field that would identify something about that particular address, such as client lives here certain times of the month or certain relationships associated with this address. I'm not going to fill that in. It's not required. City is required. Zip code is not. And county is required. I'm going to identify that as my primary address for this person, in which case that's where the mail and most of the reporting labels and such would be sent. I'm even going to add this address and add another as well. So that keeps me in this step for my next one. And notice that primary address is not available to me for selection. If I had made a mistake and needed to change that, I could not change it right here. Instead, when I finish the client wizard, I would change it in the tree itself. I'm all through with my addresses, so I'm going to do a next. And now I'm going to say, yes, I want to continue to step 4. Step 4 is where we identify contact information for either the client or for members of the household. This one particular client contact I want is for the mother, and I'm going to identify the home phone as a preferred method of contact and supply the number. I'm going to add this contact and stay in the step to add a second contact. time an email address. If I try to add it without supplying the required information, I get this to pop up. And I'm done with my contacts, so I'm just going to do a next. And I'm presented with my summary. And this is where, if I find information that is not correct, I would click in the previous button down here, click on that button, and I could return to one of those steps and correct it. Since it looks good to me, I'm going to click on Finish, at which point we have an ID that's assigned. The client ID 773 in this case has been assigned to Gene, and now it becomes part of the HCCN data system. So this is the building block for everything that follows. You need to get the person, the client, in the system. What we typically say here is that you should go and click on the Load Client link so that you can begin assigning other information such as intake interview data or action plan data, assessment data. So I'm going to go ahead and click Load. Had I wanted to assign a whole bunch of them, I could have gone in and just continued on in that very same screen. Notice how when I added Gene to that system, it just moved the tab down one to the right, and I've continued to stay active on Gene and Grady, Mona Grady. Okay, so what I thought I'd do now is just walk through some of the additional branches since we've finished the client add, which is, like I said, the building block to the system. Probably the first thing you'd want to do is work on the intake interview. And this is the area of the screen, or the area of the HCCN system that you spend a lot of your time in. It's broken down into a couple different sections. The information that's pretty general you see at the beginning with dates and contact methods and how did family hear about HCP. And then we go into more details in the interview questions section of the program. You'll notice that most of these fields are required. And I've been in the habit of using my mouse to direct myself to different fields instead of the tab key. Just go ahead and select what is appropriate. I'll just indicate the intake completed by is an example of our staff drop-downs, and these will be dependent upon the users that have been set up for your site and their particular titles. These are changeable from time to time, and you'll be working with myself and Annie and Shirley to confirm this information. So in our test database, I'll just select Mary for now. Requesting information only will be pretty important for just basic sorts of clients that are coming through that don't require a lot of services. Once you click on yes, you'll be presented with these drop-down choices, and of course you choose all that apply. And then I'm going to identify the information given to family by as appropriate. And then I'll move to the date intake completed. Be very careful of this date in that we use it in combination with the Save button in order to write a final post, I guess you'd call it, to this interview. So once you identify the intake date completed and click on Save, again, you will not be able to change this intake interview information. So I'll put today's date in there by just clicking on the calendar and clicking on today. So moving into the interview questions, there are only 3 real questions that come up for client requesting information only. Does Jean need the care coordination services? I'm going to say no to that. Anybody else providing? I'm going to say no. And here, I'm going to say I do not want to proceed to intake interview questions 4 through 16. And, technically you could say yes to this and go beyond, but for now, for the sake of this demonstration, I'm going to say no. From there, you get this case closure prompt. Do you want to close the case? I'm going to say yes for this demonstration. And then I'm presenting with close, yes or no. Do I really want to close after the information has been given? I'm going to say yes. In which case, I'm going to have to put somebody's name on it as doing that closure. And I'm just going to say Tom. So at this point, I'm going to review all my information, making sure it's the way I want it. And if that's true, then I'll go ahead and click Save. I'm going to OK through the success window. And that's essentially going to mark it as a closed client within the HCCN data system. And that's how I came up with that red highlighting when I first looked at the search for Mona Grady, is by going through the same sort of process. So if I looked at her, by going to her and clicking on main, that in-active status with the red circle is really what you're going to get when you get a case closure. So going back to Jean, the one I just added to the system, all I did was I clicked on main and I get this view. Wanted to point out a couple little things too. I skipped over. In the main view, if we call it, you're going to get some information like primary address and primary contact to come up to help you manage the client. After you've added the client, like I've done, you can go in and update certain pieces of the main information, even though I've made the client inactive. And you can see those here. For instance, I could identify gender, some other pieces of information, the Hispanic question, etc. If I wanted to reactivate the client, I could do that within main just by clicking on this and then identifying my update. Looking at the tree, there are a couple of little things. If you take a look at this umbrella next to Mary Grabowski's entry, that just means that she is the legal guardian. So that's identified there. So just a quick view, you can see it in the tree. If I wanted to go back in and change address information, as you'd probably guess, look at the address tree branch and then select one of the rows within the grid. I'm going to demonstrate how you can delete information. If you want to go in and just take away one of the grid rows, just call it up with View and then just click on Delete. Every user within the HCCN data system has the ability to delete rows of information with the exception of the client itself. The client will remain unless you send us an email or give me a call. Then I can work with the developers, Bruce and Paul, and we'll run our scripts to delete that client from the SHCN data system. But in this case, I'm only deleting the address, so I'm going to delete this record, yes. And that's the only chance you have to back out of that operation is in that window. So as you can see, it's gone. Other areas that you probably focus on, the assessment area, as Annie had mentioned. The SHCN system works this way for nearly all of its branches. You click on the branch itself, and if there is information for that branch, it'll come up in the grid. If there isn't, you just add new. So within assessment, we're going to ask for the date, or actually require the date. I'm going to use today's date, and I'm going to say that the social worker completed this. I'm going to add. And then I can go ahead and view it again and go with a new review on it by adding new. I'm going to post-date this one to November 5th as reviewed by the family coordinator and click on Add. So now that I've completed my assessment, I can go into an area such as the conditions, and I can add conditions or a condition to Gene's client file. So by selecting a condition such as asthma and choose a category that makes sense, and I'll just point out that if you do not have a particular category, you do not need to fill it. But at this point, notice the type is blank because I have not identified the diagnosis category. If I want to add it, I just click on Add, and I've got my information. Notice that ICD-9 diagnosis is blank. I do have my audit information as the person and the date that it occurred. If I wanted to delete it, I could do that at this time. I wanted to show you a little bit about communications. In the CHIRP system, we used to have a lot of information within communications, that tree branch. The SHCN system is a little bit different in that communications that are found here are either going to be found from CHIRP clients that have been converted, or they're going to be just system-generated data that have come over. So as you can see today, this afternoon, I have created a couple of rows of information. If I click on View for Gene, I can see that I've made this person active, and I've got my record information down below. You cannot change this nor delete it. This is where I made Gene inactive. So typically communications will be not only just view only, but they'll be fairly low in number for a given client. It's just system-related changes. Now, the difference to think about for a given client is going to be the notifications compared with communications. Notifications, on the other hand, are going to be events that are coming through that we have created, either through CRCSN or through action that we've taken, like a transfer. If I click on notification for, I think Mona might have a couple. Let's see. No. Anyway, if there was a transfer for Mona, then it would be within here. We'd see that. Pending system messages is an area that is similar to the alerts that you used to have in CHIRP, and that's going to be helpful for you as you manage your site. If you click on load, we'll see that for this particular person, Samuel Adams, client 686, there was a transfer requested. So if I just click on view, we'll see the notes indicate that the transfer was from Tri-County to Denver. There's also a note about updating the address specifically to take care of this change. And then I have on my right-hand side of the screen a mark as viewed. If I click on mark as viewed, then that particular notification will no longer come up in my pending system messages. Transfer is probably one of the most common notifications that you'll have in your site. The other one being the CRCSNs. So watch specifically for those that require something like mark as viewed. If I click on that and close it, that particular one won't come up again. So you can see there's no incoming system messages at this time. So that's how I know there are no notifications for me. And the notifications are, or the system messages I should say, they're going to be by site. So when you log in, anyone that's approved for that site will see the system messages in the top left-hand corner if there are any for that site. Moving down the tree, we have IDs. This is an area that you go in to help identify certain pieces of information for the client. And if you pull that drop down, you can see that there are about 8 or 10 different choices. Some clients would need information to help them track properly through the system, and an example might be the LHA, the local health agency registration number. So you could identify anything that you want in here, and it would become available to you in your searches. Insurance can be handled in a couple of ways. You can either enter insurance data within the tree or from the tree just by adding new here and selecting. And I'll point out that Medicaid does have a subtype associated with it. The others do not. So if I click Add, this very basic information of insurance gets added to the client. There is no special thing such as a primary or secondary that we identify. So as an example, for TRICARE, there is no subtype that goes with it. Like most of these, I can add, and then if I want to come back in, I can, of course, delete. Just by clicking on delete. And again, there's that confirm delete. Race can be added at this point, or we can go into social determinants of health and add race there. So the first thing we want to know is there a single parent household involved here? So if I say yes to this, again, these are required fields, and then go to, let's say, 16 years or less with a high school graduate, then I'm going to save this general information, and then click here to add race. If you do not add, or if you do not click on the save, then that information is going to be lost, but I did. So I'll click to enter the race at this point for this person. And add there. So within social determinants again, I'm going to move into percent of poverty just by clicking on the bar, the percent of poverty bar. I see there's nothing established, so I want to add new. Again, these orange highlighted fields are required, so I'm going to put my digits in. I'm going to say there's just one adult and 4 children. Annual income is going to be $18,000. And just key the digits. Do not key anything else. Had I not had any of this information, let's just say that the adults I wasn't sure about, I could have removed it and then selected a drop-down saying don't know or not sure, as an example. If I do that and click on add, just be aware that the percent of poverty will not be calculated for you. So we encourage everybody to provide the actual numerical information. When I add the record then, information is available. I can see that's at 68.8% roughly of the poverty level. We do track these by year, and so we provide this in the grid. You'll see next year, for instance, there will be another row down here, provided you fill it out, and we will be able to go back in time and see what the percent was for each year for that client. Just moving down the tree, we do have a sample letter in training at this point. So if I clicked on letter and then go to the drop down, there is an example of a CYSHCN letter. Just by clicking on submit, it goes out to work and produces this information. Within the HCP system, you can go in and select a different format, create a PDF file, for instance, format, just by selecting it and then clicking on export. So that's just a sample letter that has been programmed. The sample letter would be available for the particular client that's up on your screen that's been searched and brought out to the active tab. Another example that we have for you is in the reports area. If you click on reports, you'll have some choices within the select a report drop-down. You could go in and identify sample report with the dates that are applicable. Typically these are for a 1 month period. I'm going to open it up to everything at this point. And submit it. And just like before, I get to select the format, and then I can go in and save the file or print the file as needed. And there will be more of these that are programmed in the near future. I just clear out of that. When I leave my reports menu, I must go to my username and then down to IDS data system. That's the safest way to leave reports. At this point, I'm left at my home screen, and then I can come back to any or either of the tabs that are open. And then just click on an appropriate tree branch. The last one I wanted to show you just real quick is on transfers. So if I go to transfer and add new, I'm essentially saying that I'm going to move or request that gene be transferred from the current site, which is Denver, to another site. So if I go from Denver to, say, Eagle County, and then click on transfer, that will generate a system message for me. And then Eagle County can work on that person or update information for gene as required. This is the information that you would see for Jean for her account. You can't really modify anything, but it's just information only. If I wanted to perform another search, I could at this time just by going to my search button and then keying in any of these pieces of information. Some of these we've not really covered today, but you can explore them for yourself. One of the things I did want to show you is that the also known as or nickname is going to be available in first name and in last name. So if there was a person with a nickname of Buttons, for instance, I could do that and search for that person. And I'd see that there are a couple out there. Both of these happen to be within the Denver program. If they were not within the Denver program, they would show up with kind of like an orange highlight, and the load button would not be available to you. I'll see if I can find one like that. For example, here's one, Josh Chief, number 560. That person is found in Alamosa only, and so since I'm under the Denver site, I don't have the option to even load that person. But that would be one that is requested as a transfer. That's why the status or that first column has transfer under it. If on the other hand I wanted to go to this one, Josh Jones, I could load that person. And that pretty much wraps up the tree and the different components of SHIN at this point. In terms of the next steps in what you'd want to do, as a new user for SHIN, you're going to want to go to the Request a New User document that was in the group or the packet as an attachment, and you'd want to follow those directions in order to request that you be granted a username and password on the training system. Once you have that, request made, then you'll be able to actually log in to the system and perform the scenarios 1, 2, and 3, which are also in the packet. As you can see, I've got my name and credentials, or my information, my contact information right here. So that's available to you. This slide just talks about how you can click on the links in order to get started. The help desk, as mentioned before, is 692-2384. In terms of learning more about the system, that's going to be available to you in the packet. You're going to be practicing on the SHCN data system. You're going to contact the staff members as appropriate. There are frequently asked questions, of course, on the hcpcolorado.org link. And then there's a training evaluation that's going to be requested of you too. This time we're going to have Annie explain a few more things to you.
Thank you, Dale. That was an impressive piece of work that you just explained. It's actually quite simple once you get to know it. It looks a little daunting, but I just urge you to try it and play with it and get to know it. Please take out the Next Steps handout in your package of information. It says Next Steps, Implementation of HCP Care Coordination and CYSHCN Data System. Okay, there are a few next steps that I'd like to go over with you. Dale mentioned, and he gave you a very good introduction about practicing on the SHCN data system. I urge you to go ahead and practice because that way you will be able to be comfortable by the time you have an actual client of your own to enter. The link to use for practicing on the training data system is on this Next Steps handout. I'm not going to read it. It's listed in blue there. And just notice that the link to use when you're requesting a new user account in the new SHCN data system looks like the same link, except for training is taken off of the end of PHI. So don't get those two confused. There's one link to use for the training data system, and then there's another link to use when requesting a new user account in the new SHCN data system. You'll be able to look at frequently asked questions from other training sessions on the website. That's another way to take some steps towards gaining comfort with the SHCN data system. And then lastly, you can use the state staff contact list to call with specific questions. I'd like to point out on my contact is not written correctly on the state staff contact list. Please write it down. It's Ann, A-N-N dot Whitehouse, W-H-I-T-E-H-O-U-S-E at state.co.us. The phone number is correct. Let me go over a few timelines and next steps for implementation. We will be stopping the use of the CHIRP data system for care coordination entry on November 1st. The SHCN data system will be implemented on November 1st. You'll have a small window where you will not have any system available to you on November 1st. That will be from 8 to 12. For all new children starting out with care coordination after the implementation of the SHIN data system, the HCP Care Coordinators will start using the 5 components of the HCP Care Coordination process, including the required data entry. Let me just review. You will be required to do and enter the intake interview. You will be required to do an assessment and enter only the date, the HCP Care Coordinator, and that's all. And then when you get to the point of reviewing it, you'll have another review date. You'll be required to do an action plan, and all you need to do is enter the date and the HCP Care Coordinator that has done the action plan. So again, for any new children, that means kids that have come to the HCP agency after November 1st. You'll just start using the new HCP Care Coordination model with the 5 components. For all children with open records for care coordination on November 1st, the care coordinators will implement the 5 components of the care coordination process at the time of the next contact with the family. In other words, we're not going to expect that all the children with open records are going to be contacted right away after November 1st. We expect that you'll wait until they contact you for another interaction, and then you go over the five elements of our care coordination, our current care coordination program with them. You'll do the intake interview. You can review the assessment. New assessments are only needed if there hasn't been a recent assessment completed, and that is up to the care coordinator's discretion. You will have to do an action plan for all children with open records, and then of course they'll enter into the 6-month review process and be closed when necessary. As a rule of thumb, if you have not heard from a person for a year, you should probably think about closing that case out. Ensuring that the system works for your agency is important to know that you have a computer program with the browser requirements that meet the requirements for the SHIN data system. Dale Nakamis sent out an email probably a month ago, and that would have been in September, about the HCP SHIN data system and highlighting the need to use a Microsoft Internet Explorer browser version 7 or greater. For those agencies that have 7 or less, please contact Dale at the help desk 303-692-2384 to get instructions on how you can update your browser, because the SHIN data system will not work with a browser that is less than Microsoft. It needs to be at least version 7 of Microsoft Internet Explorer. I'd like to thank you for completing this training video and also offer congratulations for all the new things that you're going to be learning in the future by implementing this new care coordination model and SHIN data system. As I said, I'm the first person that you would contact with questions about HCP care coordination. Here is my name, and my internet address is wrong. Let me just point out again. It's ann.whitehouse@state.co.us. Call the HCP help desk with questions about the data system, and then you'll be talking to Dale Nakamis. Here is his number. We welcome your continued feedback and look forward to working with you. Thank you.